Hello friends, this is your friend in health, Dr. Sandeep Jassal from LiveLifeMore.com and LiveLifeMore Diet and Wellness Clinic. And in this video, we are going to talk about five practical mental health tips during COVID-19 homestay. I know you are all staying locked down in the homes, and this is going to result in a lot of health problems, not physical, but also the mental health problems. In the midst of so much of scary information floating all around us, with figures about positive cases and deaths happening due to COVID-19 health crisis, so it is increasingly difficult to segregate what to accept and what information is to be ignored. And especially so many of videos coming to me as well in WhatsApp with so much of depressing news around, and it becomes difficult. So staying informed is important, and after all, it is one way for many of us to stay updated. But while it's natural to seek information about this unfolding public health crisis, we must also take steps to protect our mental health. I can assure you that after this crisis is over, there will be a sharp rise in mental disorders like anxiety and depression. Because I am myself, by specialization, by training, a preventive health consultant, so my job is to prevent health problems and promote health. So with many patients of ours getting in touch with me on WhatsApp, on phone, and seeking guidance about certain symptoms, which sometimes I feel that they are overreacting to the symptoms. Those physical signs or symptoms are related to more of a mental underlying mental causes, mental anxieties and mental depressions. So coronavirus COVID-19 is here, and here are some practical steps that we can take today for a healthier tomorrow, which of course is going to come after the pandemic is over. Yes friends, my number one tip is that out of these 5 steps which I am going to mention to you, the number one tip is that you should understand the fight or flight response of your body. It's normal to feel anxious while you are going through this kind of a health threat, and our bodies are designed with a fight or flight mechanism or fight or flight response to keep us safe by heightening our response to a perceived danger. And part of that is done by increasing our blood pressure for some time, or increasing our heart rate for some time, and increasing our alertness, which is triggered by a hormonal response like cortisol, adrenaline. So these are the hormones which play a role, and that increases our alertness level by increasing our heart rate and blood pressure marginally. The brain is continuously seeking new informational cues to reassess the threat level. Now unfortunately, if we bombard ourselves with COVID-19 depressing news, details, headlines, images which are depressing and not pleasant to see, so we reinforce the threat signal to our brain and we perpetuate the stress response. Remember that the information we allow in will affect how we feel, and we should monitor that intake with care. Because of the impact the stress has on our bodies, is very important that our body's immune system is dependent upon the stress we expose our bodies to. So managing it during this pandemic is critical to the success of the strategies designed to reduce the contagion or the contagious nature of this disease and severity of our illness or our response to this exposed virus. Number 2 tip is that you should be selective about the news sources. Yes, this is a very important point. Where we seek information matters. Credible sources like CDC, which is the Center of Disease Control, USA, or World Health Organization, or government of your respective country can give us plain facts to counteract the sensationalism or the fear-provoking imagery found on news media. Well, you know that TRPs are the yardsticks of measuring how many eyeballs are sticking to those news channels. Updates from friends and neighbors may also include selective attention to fearful cases and stories. So carefully choosing these sources is the best way to ensure accuracy. While there is plenty of fact-based content available all around us, but social media perhaps sometimes may also be retroproductive in seeking the right information, because social media, the WhatsApp videos which you are receiving are not carrying the dates and time when they were recorded and when they were produced. So the information might not be very fresh or up to date. So try to focus on the fact that the facts may be very fluid in this kind of a very dynamically changing environment around us. Now the tip number 3 is consider the practical value of the information which you are seeking. Not all information is created equal. When we see images of workers in PPE, that is the personal protective gear, masks, gloves, caps, empty streets and armed guards all around, our brains detect a threat and react accordingly. So unfortunately, these images don't have a lot of value, as they convey very little meaningful or useful information. Wherever possible, focus on the facts in the story and not on the extraneous details or peripheral images attached to that story. So try not to look at the TV and just hear the news if you're in front of a news channel. Tip number 4 is don't underestimate or overestimate the power of language. When the media reports that the rate of infection is skyrocketing, for example, so it may trigger more anxious feelings, whereas the same sentence could be said that the rate of infection is increasing. Now, skyrocketing versus increasing, the choice of word makes it more sensational. Although it may be difficult, it's important to see through the sensationalistic language and focus on the message and the practical takeaways from the message rather than focusing upon the way it is being projected or explained or expressed. If a practical news source uses a lot of alarmist language, consider avoiding that outlook or that outlet altogether. So tip number 5, last but not the least, is set boundaries on the news consumption habit. Yes, with such a rapidly evolving situation, it can feel like even a few hours without an update will leave you in the dark and you will be in the lack of information. But while the information about COVID-19 coronavirus is constant, it is also highly repetitive. You must have felt that. The more often we receive the information, the more it will play on our minds and the more difficult it will be to disengage. So try to limit yourself, try limiting your updates between 1 to 3 designated times in a day when you would be seeing a particular news or hearing or listening to a particular news bulletin, and make the rest of the time concentrate during the rest of the time, the interim time, on something which is productive for you. It may be reading a good book, it may be listening to the music, it may be unwinding with your family members and bonding with your family. So this is what the message is. And friends, as you know that we try to share with you value added information about health, how you can practically, we gather this information from many reliable resources and do our diligent research to bring for you the information in a very highly refined and packaged form. So I hope you like the information which we try to bring for you. If you like, do share this information with your friends, with your family, who you think can benefit from this information. And till we meet again, stay blessed, stay informed, and live life more.
जिंदगी में जोड़िए कई वर्ष और जिंदगी जोड़िए उन कई वर्षों में. Live life more, live your life more.